Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.
Welcome to this edition of KOCT Community Health Matters. I'm Ray Clendenning. Today I will be speaking with the staff of the Vista Community Clinic about their community outreach programs. As many of you know, VCC is well known in San Diego, North County for the quality, affordable health services it provides to more than 58,000 North County residents of all ages each year. Along with the medical and dental care, VCC has taken an active role in improving community health by offering a wide range of health education programs to help North County residents take charge of their health and well-being. Among them is the Project Reach Youth Development Program for middle and high school students. I would like to welcome Keisha Spoor, Program Manager for Youth Development Programs, and Salvador Roman, Youth Development Coordinator at VCC. Welcome.
Thank you.
So happy to have you with us today. Keisha, please tell our viewers about Project Reach and what does Project Reach stand for?
So REACH stands for Recreation, Employee Readiness, Academic Achievement, Communication, and Healthy Lifestyles. So Project REACH is currently located at 3 sites, 1 in Vista and 2 in Oceanside. And it's a completely free program for students to come, and an average day would include academic assistance, lifestyles curriculum including gang prevention, substance abuse prevention, and teen pregnancy prevention curriculum, as well as recreation. So the kids come, they hang out, they have free snacks, they celebrate holidays together, there's food distributions for the family, so it's a very kind of holistic program that is a place for them to come after school.
So the middle and high school students, they're having a wonderful time dealing with this particular program, Project Reach, in Vista and Oceanside. Is that correct?
Right.
Okay. So who is eligible to participate in the program?
So the program is open to middle and high school students in Vista and Oceanside. And like I said, it's completely free, so any of those who want to attend can attend. Our program mostly is serving at-risk, low-income youth, and many of them would be first-generation college students as well.
Okay.
Soon to be first-generation college students.
Wonderful, that's exciting. So how is this program funded?
So our youth development programs in general have all sorts of funding, federal, state, city, all the way down to private donations. Okay. Some of our local funders have included the City of Oceanside, the City of Vista, Seroptimus International, the Oceanside Charitable Foundation, as well as the Boys and Girls Foundation.
Okay, well, that's wonderful. I'm glad that those funds are available for the students.
Definitely.
So, Sal, how does Project Reach help students succeed in school?
Well, there's many ways that we help our kids succeed in school. One is that we provide academic assistance, which is one of our core values for Project Reach. And what we do is we've established relationships with the school district here at Oceanside Unified School District, and we act as a liaison between the parents and the schools. Sometimes there's language barriers, and we work with them, providing the information that sometimes they don't get because of the language barriers, social barriers. And we also work with other departments. We work with the Oceanside Police Department to make sure that they communicate with us when they see our students in other locations that they shouldn't be. We talk to the parents, we talk to the student, and then we act as mentors. So this program, what it does is we provide them with the tools and the resources necessary for them to succeed. A lot of these kids just need a computer, simple things like that, or they just need help with it's one simple math problem that kind of allows them to finish their whole assignment. So what we do as a program is that we act as a family. And with that, we allow them to kind of motivate themselves to succeed. We're not just that parent that makes them finish their homework. They're actually wanting to finish because we're giving them goals, and they're measurable goals, and they're able to succeed these goals.
Okay, so what other activities do you offer with the REACH program?
So part of the motivation for them to kind of succeed and kind of want to do better is that we incentivize them, and we incentivize them with field trips. We do different activities. We take them out to field trips that if the program wasn't there, they'd never be able to do. For example, we've gone camping. We've gone up to Camp Lake Cuyamaca, and we've gone camping. We've taken them to soccer games, professional soccer games.
Wow.
We've taken them to places where they'll have these experiences that they'll remember for the rest of their lives. And through these experiences, we're able to connect them and kind of build more of a connection with them. And we also provide more of a skill-related activities, such as employment readiness. They'll come in as they get older, the high school students that want to apply for jobs. So we'll help them with their applications, their interview skills, doing the application with them.
Okay.
So things like that. And then we also go on field trips to museums. We'll go to college tours, UCSD, Cal State San Marcos, things like that. So we maintain that balance of them having fun as well as learning.
Okay, well that's wonderful. Keisha, how does the program really impact the students? What differences are you seeing in the lives of the kids as a result of being part of this program?
Well, more than anything else, the friendships that they build. So they are in an environment where they're motivating each other to succeed in all areas of their life, but they also have these outstanding mentors in the form of staff. We also have volunteers, which is amazing. And a lot of them aren't kids that would have necessarily thought of themselves as those types going to college. And many of them, whether it's through these skill building sessions, or kind of whatever kind of other exposure that they have, they also are now seeing themselves succeeding in a different way than they would have thought so before. So in general, it really becomes a home for them, and many of them go every day after school, and it's just a part of they go to school, they go to REACH, and it's just a part of their life.
So can you share with me perhaps a story about one of the students whose life has been affected and changed as a result of working with your program? And you don't have to identify the student by name, but just share with us a story.
Sure. Sal may be better suited just because he's been working with them on the ground.
Sal?
Yeah, definitely. We have one student who is now at the Cal State San Marcos.
Okay.
But when he started off, it's just him, his mom, and his two sisters, and he felt like he needed to work because he was the only man in his family, and he was really discouraged about pursuing higher education. And through the REACH programs, we're able to offer different types of resources, not just to him, but to his family. And then with the help of us to his family, he was able to realize that maybe I can help them more by finishing my higher education, and with the assistance of Vista Community Clinic, not just in the REACH program, but we have the luxury, because we are a clinic, that we can offer health services along with our academic assistance and all the other things that we offer through REACH. So it was kind of like, that saying, it takes a village. It really took a village for this student to actually achieve and get to that to Cal State San Marcos.
Okay, that's wonderful. So how do you recruit the students into your program?
So it depends on the site. Some of them, our staff do community outreach, but they'll also go to schools, they'll make connections. We have a health education team, so they'll know some of our youth development staff, and kind of whether it's cross sites, and they'll start to recognize us, whether it's through a VCC t-shirt. Oh, hey, I know you. Are you kind of with Project REACH? Are you with Step Up? So they just kind of get to know each other, and we do those joint field trips together, or we just had a Thanksgiving event where it was all of us together. So they're starting to recognize the faces in our department as a whole, but just generally us making a presence in the community as best as we can.
So you mentioned another program, which is not necessarily part of Project REACH, Step Up. And
That's
just
right.
give me just a brief overview of what that might be.
Sure, yeah, and there is a lot of overlap. So Step Up is also an after-school program, but this is a 3-tiered mentoring program. The first tier is college students or adults, and then there's high school and middle school students all the way down to elementary school, and they get paired up as buddies. So in this program, they have to meet certain risk factors to participate, but very similar. It's a completely free program. They attend in order to deal with some of these life skills, healthy communication, parent-child relationship, bullying prevention, all those types of things they do together, as well as kind of that leadership component of what does it mean to be a mentor and what does it mean to be mentored, and kind of have that extra relationship, somebody that they can count on.
So what do parents say about Project Reach?
They're very thankful, for one. My experiences with our parents, and we've established a great relationship with our parents. They come to us when they, one, don't understand, what's going on through the phases of these kids as they're developing, because to them, they were raised in a different culture. So having their kids being raised in the American culture, it's for them, they're in new territory. They don't understand what's happening. And it's kind of, and that's why our program offers parenting classes on how basically to promote the behavior that is desired and find ways to not eliminate but work on behaviors that are not desired, and how to do that in an effective way by positively enforcing good behaviors. Okay. And that's part of our program, that's part of our objective, is working with these parents, and that helps them increase communication with their kids. And by doing that, we create that sense of bond with them, and that helps them motivate them with their students succeed.
And are you able to keep the kids in the program from middle school through graduation?
Oh, definitely. I've had a student who started off in 6th grade, and she's going to be a junior now, and you can see them grow, and it's amazing to see them and all the accomplishments, and it makes you feel really good knowing that you were a part of their success. It takes it home, and then now that I'm seeing these students graduate, like, you almost feel like you want to tear up, because they're kind of like your kids, they're off into the world, but you feel good because you know that you've prepared them for the real world.
They do, and they always blow us away. We even have a peer advocate kind of component to the program, and these are for our superstars, so some of the older kids that want to be mentors and they want to be educators out in the community, and some of them very connected to the education side of things and connecting them to our clinic services and all kinds of stuff. So they are really given opportunities that I think that we couldn't write into our objectives, and they just kind of bring them to the table just kind of with their interests and their passions, and we get to explore that with them. So it really is wonderful.
Keisha and Sal, thank you so much for being here today and sharing the work that you're doing with the students in this community through Project Reach.
Thank you.
Thank you. Thanks for having us.
After the break, we will be speaking with Michelle Monroe, Chief Operations Officer, and Herminia Ledesma, Manager of Outreach at VCC.
Okay, Simon, what do people wear?
Clothes.
That's right, so it's important to learn how to dress yourself. Here's how it's done. Shirt, underwear, pants, socks, shoes. Underwear, always first, name tag on the back. Then pants and shirt. Go ahead and put this on. Now with the shirt, you want to make sure the first button's right, or you have to start all over again, okay? Socks left on left, right on right. Tying the shoes, we're gonna take the laces, we're gonna cross them over, we're gonna turn around where the bunny goes down in the hole, pull it tight, and bunny ears. Got it?
Most parenting is hard to do in just 2 minutes. But 2 minutes twice a day making sure they brush is easier, and it could help save them from a lifetime of tooth pain.
This is the story of a boy who is very sensitive to lights and sounds. So he built secret hiding places where nothing could get in. The boy didn't like looking people in the eye. It made him feel uncomfortable. One day, he found out he had something called autism. His family got him help, and slowly, he learned how to live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
Welcome back. We have Michelle Monroe, Chief Operations Officer, and Herminia Ledesma, Outreach Program Supervisor at VCC. Welcome, ladies.
Thank you. Thank you.
So, you're here to share with us some of the things that Vista Community Clinic does, playing an active role in the community to help residents become educated on health matters. Michelle, tell me, how do we go about getting these initiatives before the community from VCC?
Well, we offer a variety of different initiatives, and our vision statement of Vista Community Clinic is that we want to have a community where people can choose health, and we have that both in the clinic but also out in the community. And so we have an outreach team that provides education and information about things such as smoking cessation, alcohol and drug and tobacco education. We have parenting classes, nutrition classes, and we do also a lot of youth development after school programs.
That's wonderful. Sounds really exciting. Armenia, your outreach team makes sure that North County residents are aware of all of these programs and how they make use of them. Tell me about the programs and how you get the community involved with these programs.
Right, so I always like to say that outreach has to be the experts. Our team have to know everything about VCC and the programs and the services that we provide. So that's our main goal, is to get really educated and prepared staff to make sure that when we're out with clients, they're able to connect them back and really give them information about the plethora of services that we offer. The biggest thing that we do is be connected with our community. So that means being out in the field and providing just street outreach, one-on-one communication with people, and community partnerships. Our community partners are great in that they are hosting events a lot of the times where we're able to bring our information and share with event attendees. We also keep track of community calendars, so we really partner a lot with the city and their events. So specifically Vista and Oceanside, we regularly attend their events and provide support. For example, in Vista, we sponsor Health and Safety Day. And that's an event that's coming up pretty soon, and VCC is a sponsor, and we're able to provide health and safety related activities and have a VCC booth for people to come and learn about VCC, and then as well as how to be healthy and safe at VCC.
Okay. Armenia, how has the program grown over the years?
So outreach has been huge, has gone through an incredible growth. When I first started in outreach, there was only 2 of us that formed part of the team. And so now, and just recently too, we've expanded to a group of 8. A lot of, each of our roles rely on community needs. So we have 2 staff dedicated to migrant health outreach, and our newest member will be focused on Lake Elsinore outreach, which is a place that we've now started going into.
So the clinic has now expanded into the Lake Elsinore, into the Riverside County area, and will be providing services there.
Right, and the first team to go is always outreach, because we're going to be the ones to tell people that we're now there, offering the services and what all that entails.
Okay, so can you describe how the health promotions program has been successful in addressing the educational needs and issues in the community? For example, with HIV/AIDS or breast cancer.
Right, so in
breast
HPC we have different program areas. The biggest one, and HIV being one of our most long-standing programs, have found different ways to connect with clients. So as we know, all in regarding to the HIV topic, and just like any other health education topic, there's different ways to approach it. So they have a team focused on teen outreach to prevent HIV, and then a team that focuses on case management. So intervention, getting clients into treatment, making sure that they know the importance of taking their medication every day, or coming to support groups and things like that.
Okay. So if you're looking at your programs, Armenia, and for example, do you have anything for parents or for dads or that kind of thing?
Yeah, so one of the biggest and newest programs that we've just added to HPC is the Dads Club, and they'll be providing parenting education as well as case management to get the dads who participate in the program set up and really promote a healthy childhood for the child, but a healthy fatherhood and what that all entails. So in matters of, it'll cover everything from matters of health to matters of how to save money, and just really what parenting entails, and that's pretty much everything.
That's pretty exciting if you're thinking about working with fathers in the community, making sure that they understand what it is that they need to do to help their children be healthier, thrive, and really be better. That sounds like a very exciting program. Michelle, since the Affordable Care Act, many more North County residents are eligible for health insurance. But enrolling in health insurance and other social services can be rather daunting. So how is VCC helping the community with this particular program?
Well, we do a couple different things. One of which is that for the patients who come to our clinic, we help identify that they're even eligible. So a lot of our patients do not know that they're eligible either for Medi-Cal or for Cover California. And so we have several steps in place within the clinic to educate patients about their enrollment, and then we connect them to enrollment services. We also offer enrollment services to the general community. And so anyone can come into Vista Community Clinic and see one of our certified enrollment counselors. And that certified enrollment counselor will go through the process of what they need in order to apply, whether it's rental statements or utility bills, that sort of thing. Then there's a scheduled appointment where the enrollment counselor sits with the individual and they go through the application step by step through the entire thing. And they help them choose a plan. They give an unbiased information about what's available to that individual and to their family, and they complete the enrollment package. Once that's done, sometimes follow-up is needed, and so our enrollment counselors are available for follow-up appointments if necessary. And then also on a yearly basis, there's always a renewal redetermination that needs to happen, and our staff are also available to do those appointments so they can continue to have their coverage.
Do you do some of that work in the community as well as at the clinic?
We do. We do it at all 5 of our clinic sites.
Okay.
Soon to be 6 when we're in Lake Elsinore. And we also do, group events on the weekends at our clinic sites, but we also go out into the community. If a group wants us to go to them, we'll go to them. We do participate in a lot of activities.
Are there deadlines for these enrollment opportunities?
For Cover California, there's always an open enrollment period every year, so yes. But for Medi-Cal, you can enroll year-round.
Okay, that's good to know. Armenia, one of the things that VCC has been successful in doing is building partnerships in the community. And you spoke about that just a little bit before. Would you tell me about those linkages that you've built with the community and how it's benefiting the patients and the community?
Right. So coming into VCC and into outreach specifically, there are staple partnerships that we have that go hand in hand to really providing and speaking to our mission of comprehensive health services. And one of those, an example of those is MAC project, which is Head Start. And so we have a connection with their various sites. We're often invited to provide presentations to parents and also really are well connected in the Oceanside Vista libraries and even going out to their events. So an example is this summer, this past fall, with the Oceanside Library, we toured, what I like to say, toured with their bookmobile. And so wherever their bookmobile was, we went along and provided health education. The focus of our health education is just really getting people connected and aware of basic health education matters. So a lot of clients might be scared or might be, for whatever reason, unable to get to the clinic, but our goal in outreach is to be out there and bridge that gap in a sense. So, make them aware of their blood pressure or, any questions that they might have related to their health education that we're able to connect them with.
Is there anything else that either of you would like to share with us about the services that you provide through the clinic?
I would just like to say that we're always happy to come out to the community, so we love when people reach out to us. But another thing is that VCC is not just a health center, but it's really a resource center where we have programs like youth development and other programs like that speak to a very comprehensive approach to health.
Thank you, Michelle and Armenia, for being my guest on KOCT Community Health Matters, sharing information on the many ways in which VCC is helping North County residents thrive. This concludes this edition of KOCT Community Health Matters. Thank you for joining us.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District Board of Directors Community Healthcare Alliance Committee.